Welcome back. Tonight we explore ways to help you guys fall asleep.
Yep, we have delved into the depths of hypnosis, and now it's time to check out what traditional Chinese medicine or TCM has to offer.
That's right. We actually spoke to a TCM physician, Colin Chan, who is also a council member of the Singapore Chinese Physicians Association and a member of the TCM Practitioners Board here.
Let's hear from him.
Basically, there are a few causes for insomnia as far as TCM is concerned. The first thing is there is we call it a disharmony between the heart and the kidney. And for here, I would like to stress the word kidney here does not refer to kidney failure. We are talking about the energy of the kidney. Secondly, the patient has a deficiency of both the heart and the spleen, right, that causes the disturbance internally and causing him not to be able to sleep. The third case is actually due to yin deficiency in the body that causes the liver yang energy to go very high and disturbs the mind, and therefore the patient can't get into sleep. Of course, last but not least is the yin deficiency of the stomach that causes internal fire to build up, and then it disturbs the mind again, and therefore the patient can't get into sleep. Okay, all these four causes itself can be caused by endogenous factors, that means the internal organ disharmony itself. It can be also caused by exogenous factors, that is caused by external environment factors. But all cases itself, they don't come in a very well-defined specific category when they present to us in clinical sessions. They are always cases that there is a mix in symptoms rather. That means to say they cover category 1 and 2, sometimes 2 and 3. You know.
What about psychological factors? How would you classify them?
Well, psychological factors is classified into mainly the second category, or rather the third category, whereby we're talking about hyperactivity of the yang energy in the liver. So this is actually related to what the normal general public will say that is stress-induced. So when there's a stress, there is a stagnation of energy flow in the liver, so to speak, in Chinese TCM context. So when there's a stagnation in energy flow in the liver, it will affect the flow of blood and so on and so forth. So therefore, the internal, or rather the yang energy of the liver will start to build up. And to a certain extent, it will disturb the mind. And then the patient can't go into sleep.
What about in terms of treatment in that case?
Basically, treatment of insomnia is pertaining to which category the patient falls into. So we will set a basic principle of treatment for each category, and then we will each category itself has a more or less a standard prescription. But usually we will not use a standard prescription because, as I said before, they are always overlapping. So the formula itself that we give the patient will be altered as according to what the patient presents to us. And each time when the patient comes back to us for follow-up, we will also reassess the condition of the patient and see whether there are any changes. The prescription will follow the changes of the symptoms of the patient.
Is it pure, when you talk about prescription, is it just about medication, or are there other forms of treatment involved?
Okay, what we have just gone through are only herbal medications, herbal medicine, all right? And there are other forms of treatment for insomnia which will enhance the therapeutic effect. First thing, we can use acupuncture, right? Acupuncture involves normal body acupuncture, and we use ear acupuncture, we use scalp acupuncture, right? These are the ways that we treat, and also at the same time, we will give patient diet advice, TCM dietary advice as to what sort of food the patient should avoid. Depending on the severity of the insomnia, we will see which category the patient falls into and how severe are the symptoms presented to us, and we will decide whether we should tackle the symptoms first, 先治标, okay, or we will go into the symptoms as well as the source together, as in 标本同治. So these are things that we need to look into very carefully and examine the manifestation first before we can actually decide whether we should treat the symptoms first or we should treat the source. But one very important issue we have to remember is 中医治病求本, which means we will ultimately go to the source of the problem. If the patient's problem is very chronic or very acute, we will settle the symptoms first. But at the same time, we will not forget about the source of the problem. Normal permitted herbs that we can use to treat insomnia, they are called 茯苓啦、白术啦、远志啦、酸枣仁啦、当归啦。 These are some of the common ones that we use. But there are also specific herbs that we would use in order to bring down the problem. For example, if the patient has got weakness in the or weakness in the spleen, all right, we'll give something to boost the spleen, all right, or rather weakness in the kidney energy, we'll give something to boost the kidney energy, or something to soothe the liver if the yang of the liver is very high. Normal herbs used for that will be cai hu, yu jing, sao yao, etc. But all these herbs are being used only after a proper principle of treatment is set, as well as a prescription is selected. And not to forget, the dosage that we use on these herbs is not considered standard. We have to tailor it for the patient. I use 3 grams on you, I may not use 3 grams on the other person. So that's one very important issue that we have to take note. And for me personally, I always advise patients, if you do really have insomnia, visit a TCM doctor or see a Western doctor, right? Get the prescription from them and not to self-medicate. Because each individual is different, and medication that you require will be also different. And also do not recommend medication for your friends. And that's very, very important. Advise them to see a qualified physician or a doctor to get the prescription in order to solve the problem. We cannot prescribe herbs that are banned. We cannot prescribe huang lian, for example. All right. So if you prescribe something like this and you're caught, that's it. There is no mix in our prescription with Western medicine. So therefore, if the patient is actually at the same time taking other Western medicine for any other medical condition, it is the responsibility of the patient as well as the physician to communicate with each other, to know what the patient is already on, and so that alteration of the formula, TCM formula, can be done, and instruction can be given clearly of how to consume both the Western and our Chinese medication in a staggered time to avoid issues.
Okay, we don't have much time left. I'm going to ask Helmi really quickly. Experience with TCM?
It didn't work. I went for 10 sessions of acupuncture and I felt very relaxed after, but like it didn't shut my brain. It made my body feel relaxed, but it didn't shut my brain, and ultimately I think for me Western medication worked better.
Okay. Doctor, your thoughts?
Well, after listening to the TCM physician, I'm quite impressed by the fact that they have this approach where you find out what the cause is before treating. I think he said some things were very accurate, which are correct. You should get at the cause before treating. You shouldn't treat yourself. You shouldn't treat your friends. Okay? I think these principles are very sound. But what also struck me is how different. I mean, he talked about the liver and the spleen and the kidney.
Yeah. That's
we don't think
scientific.
we don't think about that at all in Western medicine. It's all in the brain and in the psyche. So it's very different. The approach is very different. And since I'm not trained in that, I won't make a comment on that, except that, as I said, there's no strong, robust evidence base for how it works. Having said that, I do refer some patients for like acupuncture, because I feel that unlike medications or herbs where I don't know what's in these herbs, but acupuncture in the hands of a good practitioner is a fairly harmless, clean needles and everything. It's fine. But I personally haven't found a great deal of success, but that hasn't stopped me from continuing to refer patients. I think hypnosis and acupuncture fall in the same category, that they're not well studied enough, but they're certainly very promising and deserve to be further studied for insomnia.
Okay, very interesting. Okay, so any last words, Celene?
Would you recommend a combined approach towards the treating of insomnia in that case?
Combined in what sense? You mean
In
traditional?
the sense that, traditional together with Western. Would that be advisable? Or?
I generally don't recommend mixing approaches. I mean, I've actually had quite a lot of good success combining cognitive behavioral approaches with a judicious and limited use of medication. This has been actually the most successful approach for me. But when I can't fix it, then I ask them to find alternatives, and that's when I might refer them to hypnosis or acupuncture, but not mixing it all. I think that would be too complicated. My personal view is that the combination of cognitive behavioral therapy with medication in the right, like he said, it's not that one size fits all. You have to tailor it to the particular patient. And I hope people go away with the message that most of the time you only need sleeping pills, if at all, for a short term. And once you hit on the right drug, like for Helmi, it will work very well for you. And then eventually I'm sure you can get off the medication.
It's true. I have to say that when I first started out, I had a certain dosage, but over the years I've taken less and less. As in, my dosage has been going down and I can sleep better. So I guess I'm doing well on medication.
Okay, so I hope you guys have gotten the message, and if you're insomniac, you can just play this show on VOD and sort of make your own decisions. So that's it from us for Point Blank. Then, bye.
Good night.